voluntarily, without
Coercion.
coercion. Good job. All right, let's go.
No, I'm just trying to think of some weird thing to say to Cole. Pass the weed.
What happens if the patient has questions that go unanswered in informed consent? Valid or invalid? Know the definitions of consent, validity, and risk. I'm not giving those to you. Say again? Know the definitions of consent, validity, and risk. I'm just letting you know ahead of time, I asked a lot of these questions in different ways. You guys remember the program I played, the CE Vantive on informed consent? You took notes. Not only should you be taking notes, but I put them up on a PowerPoint. Know what that, be familiar with that program.
Repeat the program name again?
It was CE Vantive on informed consent. If you can hear the music.
It's too
Say it one more time. C-E.
C, the letter C, the letter E, Vantive, V-A-N-T-I-V-E, Vantive, CE Vantive. Program I played, and then we go through some of those points in, I believe, in a PowerPoint thereafter. We talked about dual relationships in relations to sexual boundaries. If you have a dual relationship with a patient, are they more inclined or less inclined to bring like a negligence suit against you? Distraction, everybody short-term memory just went.
You take that.
If you have a non-sexual dual relationship with a patient, and then are they more likely or less likely to file a negligence suit against you?
Less.
Depends if the relationship goes down.
Actually, I feel like it'd be more likely because it's.
Somebody gave the right answer. A couple people gave the right answer.
You yourself.
Can you provide gifts to patients who refer people to your office?
Yes.
So somebody's gonna get it right, and somebody's gonna get it wrong.
It's like cards. That's a gift.
I'll just refer you to the term fee splitting, and you can do the research, yeah. If you participate in a conscious decision to violate the scope of practice, will your malpractice carrier, negligence carrier cover you?
It's a conscious decision.
Conscious decision
And
to
you know-
violate your standard of practice,
And
to
you
violate the scope of practice.
No.
So they will do what? Defend you until
I can't.
you're found responsible, and then they're gonna drop you like a hot potato.
Are they still liable for the damages?
No, you cannot buy criminal insurance. You consciously violated the Scope of Practice Act. You're on your own. Once you're found responsible,
So when you compare, if you try somebody getting a DUI, they're insured by Allstate, they sue Allstate, then he gets guilty of the DUI, and then they can't sue Allstate anymore? Or is that completely different?
that's a little different scenario. It's a very different scenario. If you're a professional, and is it against the law for you to have sex with a patient?
Right.
So an allegation is now made that you are guilty of sexual misconduct. The carrier will defend you up until the point that you are found guilty, and then you're on your own. Because you made a decision to act criminally. I see the similarities with DUI. I'm not sure how you're.
Why don't you get all your premiums back and pay them, and then you screw you, you got guilty, that's not. Well, I'll pay for the insurance and all.
No, go the other way. Don't violate the law. You don't have to worry about.
Well, I can agree, but what if you get, in the end, some people get found guilty of DUI?
And you're good, well, and they will pay a penalty for that, right? Several penalties, both criminally and civilly.
That's interesting. How long has that happened? That's forever? Just out of curiosity.
In negligence, yeah, that's. What's the most common reason, common allegation against chiropractors?
Sexual misconduct.
The most common allegation against the chiropractor.
It's something to do with the disc.
No, because, what did you
Slip disc.
slip disc?
Slip disc. Slip disc.
Or like disc?
Let's use doctor words.
Herniated disc.
Disc herniation, there we go.
There we go.
Thank you very much.
When an allegation has been brought against a doctor, what is the first line of defense for that doctor? What is the test to determine whether or not you follow the standard of care?
Would another chiropractor do this in the same?
You guys are smart.
Would another chiropractor do that in the
What's
same
the
situation?
last step in the standard of care? Last one. And I think I prefaced it by saying it's the one that we struggle with the most.
Recording? Like document?
The last step in standard of care
Follow up.
is what?
Follow up.
Again, doctor words. No, that's the oath. The last step in the standard of care.
Not be afraid to refer out if it's out of your scope of practice. That's reassess.
Say that again?
Out of scope of practice.
No? Said something after that.
Reassess.
We're never actually reassessing. What are we doing? We're assessing the effectiveness of the care to date, right? And then making appropriate changes. Right? How do you know what you're doing is working if you don't assess the patient at some point in time? I think, if I remember correctly, the term I used was you will all use something called clinical trials, right? When a patient starts in your office, you'll apply a clinical trial. We're going to do this for this length of time, and then we're going to assess the effectiveness and make appropriate changes. Yes.
How valid is a subjective test of that? Like, let's say you come in, you ask the patient, what was your pain on a scale of 1 to 10, and then afterwards your pain on a scale of 1 to 10.
So that's a VAS, right? That's subjective. You need to look at objective science, because the patients will go, I don't feel any better. Then you'll start looking at the objective signs, range of motion's improved. But reflexes are improved, muscle strength's improved. And then if you documented that in the first place, you can now document improvement. And sometimes you have to tell the patient that they got better.
So now I have a gray area question.
Yeah.
Would any form of muscle testing be valid?
Say that, I'm sorry?
Any form of muscle testing, would that be objective measures?
Here comes the depends word again. Are you using your own subjective scale, or are you using a device to check resistance?
I guess like your own, yeah, I guess that makes it better.
You have to be able, it has to be repeatable. So you have to demonstrate that it's repeatable. If pressed.
How would you do that with a device? Like,
There's pressure devices you push down, which will limit how much pressure you have to push down to cause it to move. There have been devices, several different iterations of those devices. Very few people really use them. You can use muscle strength, as long as you've documented what it was and now what it is. So if you say something, test the biceps muscle, you push down on the biceps and there's a resistance when it moves. And 3 weeks into care, you're pushing down and you can't budge it. You can make that case. It is a bit subjective, but you're going to use that with other findings. It's never one finding, it's usually multiples. You're looking for patterns. Anytime you're caring for a patient, you're looking for patterns. I love the fact that you guys covered zero tolerance. I think it was applied correctly, but too broadly. So the zero tolerance, that doctrine is there's no consideration for intent. You either did it or you didn't. You crossed the line or you stayed on this side of the line. So in one of the slides, there's no zero tolerance for this dual relationships. You're allowed to have all kinds of dual relationships, familial, paternal, business. They're fine. You just have to separate them, right? The box, this is my professional box, this is the other box. But the doctrine of zero tolerance applies to the no consideration for intent. I didn't mean to do that. Okay, now we have to figure out how to prove it. Now it's hard, right? Because the outcome's the same, whether you intended to do it or did not intend to do it. You're talking about an outcome. Now you have to figure out the intent, and that's not always easy. And in terms of societal, what do we have? We have zero tolerance for a number of things. What is blood alcohol for an underage, for someone who's underage? 0.00, right? That's it. Anything above 0.00, they have violated. We do not tolerate abuse of children, elderly, physically or mentally handicapped. As a society, we don't stand for that. And there are some significant punishments that are applied for people who do those things. We don't have a lot of tolerance. We don't care what the intent is. You did it. You got to back off. What is vicarious liability? You are responsible for all that your agents do or say. Your assistant applies a therapeutic agent that you did not order, and it causes harm to the patient. Who's responsible? we talked a little bit about policy manuals, right? That everybody in your office, any employee, should agree to or sign something that said they have ready agreed to abide by those policies. And you should assess their knowledge on those policies. There'll be a couple of questions that apply to that. Vicarious liability is the fact that you are responsible for anything that they say and do. You're responsible for training them and making sure that they abide by your policies. And if they don't, what do you have to do? Well, you have to, in some way, shape, or form, show that you have disciplined that person. It doesn't always have to be firing them. It may be retraining. Something has to happen. You have to demonstrate that you took responsible action. Pretty sure we talked about this. Contemporaneous as opposed to ex post facto notes, which are better? Notes that are done contemporaneously, or those that are done ex post facto, which is after the fact? Which are better? Contemporaneous, right, because it's fresh in your mind. Who determines whether a note is contemporaneous or ex post facto? Be careful. Who makes that determination? Somebody said it. The doctor does. You make the case. You have to make the case that, no, this was done within X amount of hours of the patient visit, it's accurate, and I can repeat that all the time. You're gonna have a hard time trying to convince somebody that a note you made a week later is contemporaneous. But you can give it a shot. The fact that we have those, I don't know chiropractic is safe. How would you try to convince somebody that chiropractic is a safe form of healthcare? One way, what would you educate them about? Say that?
You can educate them about like malpractice.
What about
That like we technically have some of the cheapest malpractice.
it? You're probably the lowest malpractice premiums of any primary care form of entry healthcare provider.
Dr. Schneider?
Yeah.
Maybe you don't have to figure it off the top of your head, but if you compare like average chiropractor versus average primary family care physician versus average surgeon.
Yeah, I can give you rounded approximate numbers. So the average chiropractor, especially first year of practice, pays maybe somewhere between $1,500 and $2,000 a year for $1 million, $3 million coverage. It also depends on the state. Practice $1,500, $100 a month, essentially. The average medical GP medical doctor, not a specialty, but just an average general practitioner is probably paying $15,000 a month.
So chiropractic's dangerous.
Yes, we're very dangerous. And is that because insurance companies like us?
No.
It's because why? We have the fewer claims paid than any other profession, right? Or than profession. We don't hurt people. Can we? Yes. Do we? Not very often, despite the hysterics posted by GP.
If it's $15,000 a month for a GP, I can't imagine what it would be for a surgeon.
It's somewhere, like, anywhere, again, it depends on where they are, what they're doing, are they group practice, are they single practice? Some, you're talking about thousands a month instead of 100 a month. It could be 15, even if it's 1,500 a month, it's 15 times greater than what we pay. Right, it's up there, and if you get into the most, I think the highest malpractice rates are for anesthesiologists and neurosurgeons. Ooh, their mistakes are permanent, right? Who's responsible for your patients? You are. What if you're covering for another doctor? You're covering for another doctor, one of their patients walked into your office. Who's responsible for that patient? You are. Hear me say this over and over again. You are responsible for your professional obligations. Don't depend on anybody else to fulfill them. Anybody else. So in offices that train, quote unquote, train their CAs to elicit a history, which they don't normally do, you are responsible if that CA misses something. Not the CA, you. And I remember we made a distinction between taking a history and eliciting a history. Why do we make that distinction? Because patients don't know what they should tell you. They think they know. They don't have the superior knowledge and training that you do. You should know the questions to ask that patient to get an accurate history from them. And make sure you define your terms. Can you pay someone else to perform spinal screenings for you? Talk a little bit about this. Can you pay someone to refer others to your office? Let's go in the broader terms. Come on. Try to know real quick.
You can, but it has to be on an hourly basis and not a case-by-case
You
basis.
can't pay them by head count. You can pay a marketing firm to market your practice. You can pay someone to refer to do spinal screenings for you. You just can't compensate them by head count, the number of people that walk through. And the reason I put that in this class is because you will be solicited to do that for some people, for docs, and that's okay. Remember, it's their license, not yours, but you don't want your name on a wrongs list. Somebody brings to you a folder with their records in it, an MRI, could be a CAT scan, radiographs, any kind of neurological test. What are your responsibilities? I'm sorry, could you say it again? Let's assume that you have, these are the real records. What's your responsibility?
To read them.
Review them before, not after. Are you legally required to do that? Probably not. If you hurt the patient, probably yes. Let's talk about relationships. Causal, temporal, and associative. What is a causal relationship? If, then. Direct correlation, right? If I do this, this is going to happen. What's a temporal relationship? There's a relationship that concerns time. And if there's an associative relationship,
Business partners?
anybody can form an associative relationship. This is related to that, even though there may not be any relationship whatsoever. It's just somebody associated those things together, for which you have been subjected to for most of your lives.
You got a question?
Go ahead.
You said the temperate relationship is what?
Sorry?
The temperate?
Temporal is time. There's some component of time. Let me talk about stroke for a minute, because there's two questions based on stroke. Early research that was used to feed the media started off with chiropractic causes stroke. What they did was, this person, have you ever been manipulated? They didn't ask if they've been to a chiropractor. Have you ever been manipulated? Yes. And they were in the hospital because they had a stroke. It didn't matter that there was 30 years between when they were manipulated and when they experienced a stroke. They associated those two.
Of course.
Really, that was a temporal relationship that a researcher applied, yes? Is it accurate? Absolutely not. What percentage of strokes happen within the skull, intracranially?
10.
What percent?
99.
Like 99. What percent happen outside? 1. Which are the ones that are most likely related to chiropractic care?
Oh, outside.
Outside extracranial.
Extracranial.
Ooh. Which ones are most related to chiropractic care?
Extracranial.
Extracranial. The only ones we really have influence of, right? Influence of. Who's there? Only a couple more.
Dr. Schneider,
Yes.
I have a question. If someone was doing like a cranial bone adjustment, is there any possibility that could cause an intracranial stroke?
Probably not. Probably not. More than likely, you're gonna impact the vertebral artery, not the carotids. Carotids are pretty deep. Right? You have to go palpate the carotid artery, you have to push in to get to it, and it's anterior to the spine. Vertebrals are running through the deep. So more than likely, you will impact the vertebral artery. Even in a cranial adjustment, it's very hard. But those structures are pretty deep. Anatomically, when you get to, have you guys had, head and neck yet?
Yeah.
Next time you're on the anatomy table, take a look where how deep the carotid arteries are and where the vertebral arteries are. Take it 2 seconds and you can kind of figure that out really quickly. I'm lost. Claudia Equina is what? I know I told you about this. Claudia Equina is loss of,
Oh, the syndrome?
Oh, I don't
loss
know.
of
Control over your.
bowel and bladder, right? That's our disc herniation.
It's not.
Lose bowel and bladder control. How often does that happen in chiropractic? This is in the CE Vanta program, like 1 in 100 million adjustments. It's ridiculously low.
Medical.
What was the name one more time?
Claudia Equina syndrome. Here's, for those of you who want to hang for a couple of minutes, when we get done, I'll put that program up. So, for those of you who want to review on it.
That's the informed consent program you were talking about earlier too.
I'm sorry?
Is that the informed consent program you were talking about
Yes,
earlier as well?
yes. There's a lot of information in that, and there's probably 5 or 6 questions related to that particular program. PHI, know what it is? Protected health information, know what that consists of. Signs of a stroke. These 3 ends.
High blood pressure.
What about it?
Like, you said sign of a stroke, like really high.
It's a contributing factor. It can cause a stroke, depending on how high it goes.
Also, then, like the
I'm
eyes.
talking about signs of a stroke. How do you know somebody's having one?
You know, one side.
Dizziness, diplopia, right, double vision, dysarthria, difficulty swallowing, drop attacks.
Can women get pain on the right side or something?
That's usually, right arm, but that's not always true. That's like saying you have heart attacks will feel it in the left arm, and that's not true. It's sometimes.
So, when I was doing patient intakes, the patient came in with like headaches that he's been having for a week. And like it was like really bad. We couldn't find anything like with the x-rays and stuff like that. Sure enough, it's just like blood pressure and yeah, he was like having a stroke.
Well, that's one of the signs of, one of the causes of headaches is high blood pressure,
high blood pressure can cause strokes because it does what? No, we're gonna think through this.
Okay.
We're gonna work all the way through this one, it's important.
Okay, alright.
High blood pressure, right?
Right.
That means that the pressure within the arterial walls is great.
Right.
And when the numbers start to climb and get closer to one another, that means that there's no relaxation in those vessels at all. The pressure maintains at a very high level, and eventually they will leak. There will be a tear. The higher the pressure, the more likely that happens. And you're absolutely right. One of the signs is a headache unlike any other.
Yeah.
My contention with using that as the sole sign of the stroke is that if you've ever had a migraine, each one is like a headache you never had before. So you have to make a differentiation now between a migraine, headache, and a stroke. And so you have to look at some of the other issues. That doesn't mean you ignore it. You've got to pay close attention. Somebody walks in, I've never had a headache like this before. You're trying to prove that it is not a stroke before you move forward.
Okay.
Hypertension is one of the deadliest silent killers, right? Diabetes and hypertension. And they are more prevalent in what body type?
Obese. Right, yeah.
Yeah, the heavier someone is, the more likely they are likely to have hypertension and or a form of diabetes. Not everybody, not all, right? Some have thyroid issues that need to be managed, but you're looking. All right, I'm gonna put that, two things. Give me a second.
I'm kind of adjusting like over week and I'm stressing myself out. Bad combos. Someone could just like rip my head off my shoulders. I just think it did. No, like I'm like